I work for California Schools VIVA, and we're here to talk to you today about your UnitedHealthcare benefits, as well as UMR, which is your PPO offering. And then finally, we'll touch base on with Express Scripts, and then we'll talk about some additional offerings. So we'll go ahead and get started as we have a lot of information for you today. So as I mentioned, we're going to start with the UnitedHealthcare product review, along with the UMR product review. We'll also talk about Express Scripts, and then we'll end on your additional VIVA benefits and contact support services. If you do have any questions, again, please feel free to put those in, and we'll go ahead and answer those at the end of the presentation. With that being said, I'm going to go ahead and turn it over to our field account manager for UnitedHealthcare. His name is Nicholas Cruz. Nick, it is all yours.
All right. Well, thank you, Matt. I appreciate it. And hello, everyone. As Matt said, my name is Nicholas Cruz. I'm a field account manager with United Healthcare, and I have the pleasure of going over all the wonderful benefits available to you through United Healthcare. All right. Thank you, Matt. So, as always, we like to provide some reminders about the requirements of being enrolled on an HMO plan, which are the majority of the plans offered by United Healthcare. Such as members must choose an in-network primary care physician from any participating medical group in the plan network that they select. Plan selections are required at the same time of the enrollment and are locked in once they're made. Members must enroll with the members enrolled with the family are able to select different medical groups within the same network they select. So, as an example, let's say a member elects the Alliance Network. The subscriber can elect UCSD, and a spouse can elect the Scripps Clinic. They're both available on the Alliance, and members can have different medical groups. We also, when it comes to the plans, medical group changes within the plan network are allowed. When it comes to the primary care physicians, they just have to follow the guidelines for PCP changes and primary medical groups. We have a rule known as the 15-30-day rule, meaning if you call UHC to request a primary care physician change before the 15th of the month, that change is effective the 1st of the following month. If you make the request after the 15th of the month, it is processed the month after the next month. So it'd be basically a month and a half out that change goes into effect. So we always suggest and highly recommend that you call before the 15th of the month if you're looking to make a PCP change. UHC also supports and allows qualifying life event changes within each of the distinct networks. So again, those are just some of the HMO reminders and requirements that we like to throw out there at the beginning of all open enrollment years. Next slide. All right, so here we have an overview of the first plan offered by the county. This plan is known as the Performance HMO Network 1 plan. Good news for those already familiar with the plan. There are no changes for the 2024 plan year. All of the copays remain the same. So your PCP and specialists visits will be the $25 copay. Urgent cares will also be that same $25 copay. ER visits have a $125 copay, and if you are admitted to the hospital, your copay is $200. There is no deductible on this plan, and the out-of-pocket maximum is $2,000 for an individual and $6,000 for the family. Now, over on the right, you can also see a snapshot of the available medical groups on the Performance Network 1, which include a few Optum medical groups, Sharp medical groups, as well as Rady's Children. So those are the primary medical groups that are available in the San Diego area on the Network 1 plan. Next slide. All right, so here we have an overview of the Alliance plan. So there will also be no plan changes on the Alliance plan. All of the copays will remain the same here as well. They're almost the same as the Performance one with just a slight change on the specialist visit. So your PCP copay will be $25. Specialist is a $40 copay. Urgent care is the same $25 copay. ER visits are $125. If you're admitted into the hospital, it's that $200 copay. Again, there's no deductible on this plan, and the out-of-pocket maximum is $2,000 for an individual and $6,000 for the family. Now, when it comes to the Alliance plan, this would be a go-to choice for members looking to elect a Scripps PCP. With Scripps Coastal, Scripps Clinic, and Scripps Physician Medical Group, as well as Mercy Physicians available underneath the Alliance plan to members looking to elect with those particular medical groups. So just a little bit of the difference between the two if you're trying to make a decision between the two plans. Next slide. All right. So here we have the Harmony Network High Deductible Health Plan. So this plan is HSA compatible with a combined medical and RX accumulator. So to clarify that, it basically means that the accumulators are basically the RX copays from Express Scripts will be included in the medical deductible and out-of-pocket limits on the medical plan. All right, so there will be two versions of this plan. The first version will be for individuals only who are enrolling on the plan with no dependents. The individual will only have a deductible of $2,700 and an out-of-pocket limit of $3,200. Now, the family plan will apply to any member enrolling with one or more dependents. This will have a $3,200 deductible, and the family plan will also have a $3,200 individual out-of-pocket maximum and a $6,000 family out-of-pocket maximum. So for those who aren't as familiar with what a deductible and an out-of-pocket limit mean, a deductible is basically the amount a member is responsible to pay for medical services prior to the plan or UHC paying on claims. The out-of-pocket limit is the maximum amount a member will pay in a calendar year. Now, once the out-of-pocket limit is reached, UHC will cover all claims at 100%. So it's just a quick breakdown of what those mean if you're not quite familiar with what they are. Now, as you can see from the grid and the plan benefits, they're a bit different from the other plans. For a PCP visit or ER or any of the other benefits, you have a 10% copayment after the deductible is met. Now, this basically means that you are responsible to pay in full until you satisfy the respective plan deductible. Once the deductible is met, you're only responsible to pay for 10% of the allowed charges for each service that you receive. And again, that's until the out-of-pocket maximum is met. Once you reach the out-of-pocket maximum, that 10% copayment amount is waived and it's picked up at 100% by UnitedHealthcare. On the right side, you'll see a list of all the available medical groups again, which with the Harmony Network, you'll see Sharp, UCSD, and Optum Care are available medical groups in the San Diego area. All right. So here's just a kind of a side-by-side plan comparison of the costs to give you a visual, if you wanted to see them and see the differences. Again, you'll notice when it comes to PCP visits, you have that $25 copay for both the Alliance and the Network One plan. And on the Harmony plan, you have the 10% copayment after deductible. They're pretty much mirrored across the board for each of the benefits except for the specialist. Again, the VIBA Alliance plan has the $40 specialist amount there. So again, just the side-by-side to give you a visual of the differences between those when you're looking at majority of the, well, not majority, but some of the key co-payments that you'll have when going to the doctors. All right, and just as a reminder, preventative care is offered and covered on all of the plans at 100%. All UHC plans 100%. So this includes all immunizations, vaccines, exams, screenings, your annual physical, and any screening that's necessary. All of them are covered under preventative care. Please talk to your primary care physician about these services because they're absolutely free for you on the plans, and we highly recommend you get them as necessary. Next slide. Perfect. All right, so jumping right in here, we have the custom UHC County of San Diego dedicated member site. The site is up at the top. It's that yuhc.com/COSD. Now, on this site, there's no username, email, or password required to enter the site. It's available for existing and potential members. You can view your plan options, find providers, hospitals, urgent cares, ERs, and there's also a variety of wellness benefits available to our members, some of which I'll go over in just a few minutes. And this is pretty much your a source of information for you to find all of the any answers, or excuse me, any answers to any questions you may have. This is a good source for that. And again, the main thing that I think people utilize this for is for the provider search as well, because it's broken down by individual network. You simply need to select the network that you're looking to enroll on, and then it'll take you directly to where you would enter in, a city, zip code, or provider name to verify, a list of doctors that are there, or if a specific doctor you're looking for is in network on a plan that you're potentially going to enroll into. So definitely a good source to answer any questions you may have. All right. So we at United Healthcare understand that transferring to a new medical group or transferring to United Healthcare from another carrier can be a difficult process. And one with you may have a lot of questions, about the process. Things where you're, about selecting a primary care physician, scheduling a first primary care physician appointment, transferring medical records, prescription medications, things along um, those lines. You have any of those questions, we highly recommend that you reach out to the VIBA advocacy team. The number and email are listed there. Now, when it comes to this, they have a list of resources and websites for each one of the individual medical groups that you may be looking at transitioning to in the San Diego area to help that process and ease that process, along with specific phone numbers you can reach out to about the process to, transfer medical records and things like that. So we highly recommend, again, if you're looking to make those changes this year, reach out to them. You can also reach out directly to our customer service team here at United Healthcare. They have the same resources available. Those are the two main sources that we recommend you contact to get those questions answered and ease that process. All right, so here we have the UHC member ID card. And now ID cards provide all of the information necessary when seeking medical services, such as your member ID number, group numbers, your assigned primary care physician, medical group, and there's also general copays. And if there's any applicable deductible or out of pocket on your plan, it'll be listed on the card as well. The back of the ID card also has a wealth of information available to you, which includes the dedicated customer service number. That number is 888-586-6365. The mental health support number is also there, and also a provider support number. So if the provider has any questions they want to verify and they're not sure where to call, that number is on the back of your card as well. So easy for all of the contact points that you can reach out to in the case of questions when you're seeking services. You'll also find the claims address. In case for some reason you have to send in a claim, that address is listed on the back of the card where you can send, the claim via mail. Now, just as a reminder, anytime there is a change to any of the information listed on your ID card, a new one will be generated and sent out within 7 to 10 business days of the change. And you also want to be sure to throw out that old card to avoid any confusion when you're seeking services, of accidentally handing the wrong card and being charged the wrong copay, things along those lines. So it's always good to make sure you throw out that old one when you make any changes. All right, so here we have the myuhc.com website, and this is United Healthcare's member portal. So on this site, you can do things like view claims, bills, referral status. You can change PCP. You can search our networks for providers. This is also where you access programs like virtual visits. You can also print a temporary ID card, and some of the other wellness benefits like OnePass and all of that are available to access through here as well. So if you haven't registered, all you need to do is have your insurance card handy and go to myuhc.com to register and create a profile. There is also a MyUHC app available where you can download it directly to your phone and log in and access all of the same functions on the website through the app. So definitely a good source to have and a good app to download as a United Healthcare member. One key thing I like to call out when it comes to the app that's on your phone or even the site, there are digital ID cards available through the app. It's available within 48 hours of a change being processed. So as I mentioned earlier, it takes 7 to 10 days for that card to be received in the mail. But let's say you have a doctor's appointment, in a few days after you made a change, you can go on the app and that digital card that you can simply show to the at the doctor's office is available within 48 hours on there. So definitely a good source, and if you're like me and lose your card sometimes, because I do it, that's a good source to always have too. So definitely a good app to download as a UHC member. Next, we have virtual visits, and this is where, of course, members can skip the lines and wait times of a doctor's office or even urgent cares. You can access care from your mobile device or a computer 24/7. There's no appointment needed. We have 4 contracted provider groups in network, and these are Optum Virtual Care, Amwell, Doctor on Demand, and Teledoc. Virtual visits are great for treating things. There's a list of them there: the rashes, pink eye, sinus infections, flu, bronchitis. There's a wealth of benefits to doing a virtual visit, and a great opportunity where you don't have to go wait in those lines at the doctor's office or wait for an appointment, a week out or somewhat. You can just get a virtual visit. So again, you can access virtual visits through the app, the MyUHC app, or even going online to myuhc.com is the source to access that. Able to. So the Able to app is one of our newest benefits offered to by United Healthcare. This is a virtual behavioral coaching program, and it's for managing things like stress, anxiety, or depression. And basically, what it is it's a um, coach-led virtual visit, and it's a program where there's 8 weeks or 8 sessions of one-on-one weekly coaching via phone or video chat with that coach. The great thing about it, which is a little bit different, is you have the ability to chat with that coach in between sessions throughout the week. So as you know, sometimes you don't want to wait a week to talk through an issue. You want to talk through it right then and there. And this gives you the ability to do that rather than having to wait for that session, that's a week out. So it's definitely a great program. We're getting a lot of great feedback on it and highly recommend members to take advantage of it. OnePass. So OnePass is our subscription-based fitness network. It's a network of gyms and studios. The great thing about OnePass is it offers freedom of choice between 4 different tier options. So those tiers are listed as Total Fitness, Universal, Premium, and Ultra Fitness. Each tier ranges in price, but the beginning tier starts at $25 a month. It goes all the way up to $139 a month for some of the really unique boutiques and more expensive gyms. But it is there's $0 enrollment fees, and each tier offers multi-location access, where basically you have the freedom to change locations at any time, and the ability to access all of the amenities and services each one of the gyms offer, including the classes, that they offer as well. So it's great for if you're somebody who travels a lot, or just maybe you run out of classes at your gym because they offer a limited amount. Well, you run out of classes with one gym, you can hop to another one, within the one past tier that you're on, and continue with those classes and don't have to wait till the next month. So it really offers up, again, that freedom, with your gym access. So definitely a great program with that. Next slide. All right. Chiropractic and acupuncture services. So these services will now be available to all VIBA and UHC members. The coverage is offered through Optum Health, which includes unlimited visits. Those visits are subject to medical necessity. And your copays will match that of the plan that you select. So whatever your copay is on your plan, for the PCP office visit, it will be the same for your chiropractic and acupuncture services. Now, if you're looking for providers for these services, it is a different site than the ones that were previously provided. You have to go to My Optum Health, Physical Health of CA.com. A bit of a long site, but again, it's My Optum Health, Physical Health of CA.com. And one thing you want to be sure when you're looking for those providers, there's a plan product section in the provider search section. You want to always select California Schools VIBA in the dropdown. So again, in the plan product section, always select California Schools VIBA to make sure that you get an accurate list of providers. All right. So, as a reminder, UHC is always here to help. We have dedicated teams standing by to help and answer any of the questions or issues that you may have throughout the year. So again, those numbers are all listed there. Dedicated VIBA customer service number. Again, it's on the back of your ID card, but we like to call it out. That's the 888-586-6365. Your behavioral health customer service number. It's the 888-625-4809. And of course, the site that I shared, the member site, that yuhc.com/COSD, and then the myuhc.com UHC portal. All right. Well, that is all I have for you today. I appreciate your time, and I will go ahead and I believe I'm passing it on to Rochelle at UMR.
Thanks, Nick. Really appreciate it. So now we're going to transition into your UMR PPO plan. So the field account manager is Rochelle Rabuco for that. So Rochelle, I'll go ahead and turn it over to you to discuss the PPO offering.
All right. Thank you, Matt. And good afternoon, everyone. As Dave mentioned, I am your dedicated account manager for PPO from the UMR side of your plans. And I'm actually here to present to you your PPO benefit plans, as well as the tools and resources that's available to you. Okay, so what is UMR, or who is UMR? So UMR is our third-party benefit administrator. I guess I'm sorry, my eyes all of a sudden started tearing up. And we're here to assist you with managing your health benefit plans for California School VIBA or for County of San Diego. And with your UMR benefits, you have access to the UnitedHealthcare Select Network, which we'll discuss in detail in the next few slides. I will also talk to you about your PPO benefit coverage and how you could select a provider and other resources that will give you the tools in getting the most out of your plan. And as your benefit administrator, we are here to assist you with your health claims administration, making sure that you are assisted with coaching and basically handled your questions and claims issues quickly and accurately. And also, if you're dealing with any of the chronic medical conditions, or if you're in a hospital, we have medical professionals that are here to help coordinate your care and help you find the benefits that's especially crucial to the time that you need to accomplish your process. And I apologize, I'm stumbling here. The next slide, please. So with your PPO network, what is exactly a PPO? So PPO network are providers that are contracted with UnitedHealthcare, and we have a group of doctors and hospitals and other healthcare providers who are networked with or offer network discounts on the services that they provide. A great benefit to you if you go to an in-network provider is basically cost savings. When you receive care from an in-network provider, the plan typically pays the bigger portion of the cost and you pay less out of pocket. Another benefit is your ability to self-refer to providers. So you do not need to have a provider to refer you to a specialist. You can pretty much have the freedom of choice to decide, hey, I'm interested in, getting a rash checked out or like for dermatology or something like that. That's something that you have a freedom of choice to do. You do not have to wait for a provider to self-refer you or refer you to. If you're enrolled in a PPO plan, you have the flexibility to switch to different primary care physicians at any time. And like I said, you can see a specialist without a referral. And this could also include not just like the dermatologist, but gynecologists, infectious disease doctors, and many other options that you may need to consult with. Slide, please. Here we have a high-level overview of what your PPO plan basically offers to you. So on here, you will see that you have your deductible for individual, it's $300, $600 for your family. And basically the co-insurance is that the plan pays 80%, which means you'll be paying 20% once the deductible's been met. And the most that you can expect to pay for your out-of-pocket for individuals are $2,300, and for family, $4,600. And as many of you know, for office visits for in-network providers, you're looking at a primary care copay of $20, and for a specialist, $40 copay. And let's see, what else is here? We do include you do have an out-of-network coverage, as you can see to the right for out-of-network services. It's always best to utilize the in-network coverage whenever possible, though, and we encourage you to choose that. And you don't, like as mentioned before, you do not need to choose a primary care provider or to get referrals, but we do highly encourage and suggest that you do because they can be helpful in managing your care. The next slide, guys, just basically shows a couple more information about what's covered with your PPO plan. So should you get an inpatient hospitalization, you're looking to do a $150 copay per admission, and then it'll be 80% paid by the plan after the deductible. Urgent care visits, you're looking to pay $75 copay per visit. Emergency room is $125 copay per visit. And then we also include therapy services such as occupational, physical, or speech therapy. You're looking to pay $20 per visit, and there is an annual unlimited visits, but will require medical necessity approval after the 30th visit. And then, as I mentioned by UHC, we also offer a lot of the preventative care screenings and immunizations at zero copay, and your deductible is waived. So we highly encourage that you and your family members seek out your preventative services or even your immunizations for flu shots and things like that, as it's free and available to you. Slide, please. Here you have a visual of your medical card. We have the front and the back. As you can see on the front of the card, you will find the member ID, just similar to UHC. The member ID is assigned specifically to you to track all of your benefits and claims information. There's a list of the family members covered under your plan. Your medical provider network is also referred to as your preferred provider organization. It's going to the doctors is also listed on here on the bottom right-hand corner. The number assigned to identify your group for the health plan is also here on the top right corner underneath the logo. You will also see the copays assigned to your plan, such as the office visits, specialists, and copays and ER, sort of to the left bottom of the card. And then and also to the right of the card, you will see that your pharmacy benefits information is also listed in there. And as you can see, it's listed as Express Scripts. And on the bottom section, I'm sorry, the back of your card will also show you the deductibles and out-of-pocket maximums on the top left-hand corner for in-network and out-of-network as well. And just like the UHC ID card, you have your specific numbers or dedicated numbers to call for member assistance. We also have the nurse line number on here, as well as pharmacy help desk, the claims address, Express Scripts phone number, should you need to contact them if you have any questions or issues. And again, for your providers, should they have any questions or need assistance trying to confirm your benefits, there's also a provider 800 number that they can be called. Next slide, please. So it's important to remember that you will have access to umr.com website after you have been enrolled. After you receive your member ID card, make sure that umr.com is the first stop that you go, because you will be able to find everything that you want or would need on this site to be able to start your care or even just view any of your claims. Claims and benefits information in here. With the access to the UMR website, you can see the benefits and information anytime on the desktop or on your smartphone device. From the My menu, you can basically check your benefits and highlights of your plan, the co-payments and the co-insurance, similar to the information that you can see on your card, but this can actually dive in deep on the information on the portal. You can also see the amounts of your office visits. You can review your deductibles and out-of-pockets. The website basically gives you access to the explanation of benefits and view all of your medical claims. This is also the fastest and easiest way to check the status of your claim should you be curious to know if it's already been paid, or if it's still pending, or if it was denied. You can also learn about medical conditions and treatment options through the umr.com site. To the right of the screen, and I apologize, I had to kind of squeeze this information in here. There's a few things that you need to know about the registration process. If you are an adult that's age 18 and over, you would need to grant access to the information in order for the plan holder to be able to see the claims and benefit details. In other words, the plan holders cannot see like a spouse or an adult dependent's claims and benefits or eligible information unless the spouse or the adult dependent grants you the access. But each and every one of you will basically be able to set up your own access by just logging in and selecting account settings, an icon at the top of the page, and in the access privileges section, make the appropriate security selections for them to be able to grant access for now. Slide, please. So with the umr.com, you will be able to basically also look up your providers. Go to the umr.com from a device, select find a provider, and you can look up your provider by the network on your ID card. And basically, you can also, we have what we call a tile, which is this little white tile with the image of a doctor on it. And you can click onto this and it'll direct you to your specific network, and you'd be able to find a provider. You can search by name, zip code, or specific address. You can also look for hospitals or any kind of specialties using this site, and it'll direct you to in-network providers. I added the portion of the mental health because you also have the option of being able to look up mental health providers. Again, we have a tile. Oh, there you go. We have a tile that has a behavioral health directory, and you can be able to select behavioral health providers on here. And if you're having issues connecting via umr.com, you can also call our toll-free number of 1-800-826-9781 and ask a representative for help. And we do have dedicated representatives that is familiar with your plan that will be able to assist you and guide you to finding a in-network provider. Slide, please. And just as kind of like with UHC, we also have a app for UMR. We call it UMR on the go. So everything that you can access via umr.com, you should also be able to access via your phone. It makes it a little bit easier, kind of like what Nick had mentioned about, for those that maybe, that you loses their cards, you can also be able to pull up your ID card on the app. You can send a copy of your ID card to your medical provider using the app. So everything is kind of done electronically. You would also be able to look up any of your upcoming appointments on here or any recent or medical dental claims. And you can also use a chat feature on the UMR to go or call or message a UMR member support team for assistance should you need to do that. Next slide, please. So with a PPO plan, you do not need to select a PCP, but we do highly encourage that you choose a primary care physician. With a primary care physician doctor, you can pretty much go for most of your general health care needs to them, and they basically establish a relationship for the continuity of care and routine checkups and health screenings, immunizations, and they can help manage your preventative care. You can also address any health concerns. Your primary care physicians is also aware that your overall health, you can address them quickly. You can also help manage your prescriptions and medications. And pretty much they can also even recommend a specialist for you if that's something that you'd like assistance with. But like I said, with a PPO plan, you're not required to select a provider, but we do highly encourage this because they can help manage your care. There are certain services that would require prior authorizations, and to the right hand side of the screen you will see that we put some of this list together, and this is just to help make sure that the services that you're seeking are medically necessary and that it would help care for your cutting down your costs. If you are a dependent that's going to be admitted in a hospital or receive certain outpatient services, UMR may require prior authorization. So your provider may be asked to provide certain information to confirm the services and that states that it's medically necessary. But this can be coordinated again with the fact that you have a primary care physician, which we highly recommend that you do select. They can coordinate a lot of your preventative care services as well. Slide. Similar to UnitedHealthcare, we also offer teledoc. So again, teledoc is just a virtual way of seeing your providers. We understand that some folks, due to the pandemic, they kind of got accustomed to being able to see a provider from the comfort of their own home. They can talk to a doctor within 10 minutes, anytime, anywhere, and we pretty much have a doctor that can treat every member of the family. So if you have a baby, you can talk to a pediatrician, telephonically or virtually through using your iPhone or iPad or laptop, and be able to get the assistance that you need. And basically, you can also even have prescriptions to a for a pharmacy. I apologize. You can even get prescriptions prescribed using teledoc, and it'll just go to the pharmacy of your choice or what's on your file. And it's using teledoc basically allows you to pay less than going to an actual ER or urgent care clinic. Some of the issues that you can go see them for is just general health for like colds, flus, allergies, sinus problems, and you can even utilize it for certain specialty care like dermatology, skin conditions, or even behavioral health therapy. So these are all offered using the teledoc, and again, you would just simply go to the teledoc.com website and then register with your UMR ID number on there, and or you can call the 800 number for teledoc number to help assist with your registration. Slide, please. And one of the other services that we offer is basically the UMR nurse line. You can talk to a nurse anytime, night or day. These are experts in being able to assist and advise on certain medical issues, or wherever you need to go for care. You can chat with them online, or call them. They're available 24/7, 7 days a week. And there's translation is also available to non-English speakers. And let's see what else. And it's basically here, there's no cost to you to utilize the 24/7 nurse line. And as you can see, you could do a live chat with a nurse, or you can call the 800 number 877-950-5083 for assistance. And last but not least, we have our member services number to the right-hand side. And again, this is like how you can contact UMR, and we have dedicated representatives that can assist you with any of your questions, concerns, or issues. And these numbers are also in the back of your ID card, or you can log in to the umr.com or utilize your UMR On The Go app if you are able to download it on your phone. And UMR is ready and ready to assist you whenever you need help. So thank you for giving me the time to talk, and I apologize if I stumbled throughout the presentation.
Thank you so much, Rochelle. Really appreciate that presentation. So whether you enroll into the UnitedHealthcare HMO plans or the UMR PPO plan, then your pharmacy benefit manager is going to be through Express Scripts. And so here to present on your pharmacy benefits overview is going to be Amy Williams. So Amy, go ahead, and it is all yours.
Thank you, Matt. Yes, hi everybody. Like Matt said, my name is Amy Williams. I'm an account manager over here at Express Scripts. So I'm going to take the few minutes of your time today to talk through the pharmacy benefit, again, that accompanies your medical benefit that you are selecting. So you can go ahead to the next slide. Thank you. Express Scripts manages your prescription benefit on behalf of the County of San Diego and California Schools VIBA. Express Scripts will help patients access affordable prescription drugs safely and efficiently. Each year, as a leading pharmacy benefit manager, Express Scripts saves approximately $32 billion for nearly 100 million Americans and thousands of clients that we serve. We're here to give you better, simpler ways to manage your medication on your health. Go ahead. Next slide, please. I might be able to do it, click it myself too. Thank you. Express Scripts is committed to providing you access to proven medications at an affordable price. The medications on your drug list, also called a formulary, are covered by your prescription plan and are routinely reviewed by an independent panel of physicians and pharmacists, and they ensure you receive clinically effective care through those reviews. The medications on your prescription drug list are known as preferred medications. They include both generic medications along with brand name medications. If you fill a prescription for a non-preferred medication, you will have a higher copayment. Certain medications are excluded from your drug list, which means they're not covered. In most cases, if you fill a prescription for an excluded medication, you'll have to pay the full cost of that medication. If you're using a non-preferred or excluded medication, always talk with your doctor about moving to a preferred and covered medication that is, again, proven to be safe and effective. Otherwise, if you do find that your therapy requires that you take that medication that is excluded under the formulary, there is a coverage review process that's also available and in place that your doctor can request for you to receive coverage under the benefit. To help you stay healthy, you can receive vaccinations, including the COVID-19 vaccine, covered by your pharmacy benefit, participating in local retail pharmacy. So call your pharmacy to ask your pharmacist which vaccines are right for you. Ask your pharmacist if they can administer that recommended vaccine, if that they have it in stock, and again, learn which vaccine is covered underneath your benefit. And of course, once you go there to visit your local pharmacy for your vaccine, make sure you present your Express Scripts ID card to run it through your pharmacy benefit. Next slide. When appropriate, we encourage you to consider taking advantage of generic prescriptions. FDA-approved generic medications contain the same active ingredient as brand name counterparts and are just as effective. Millions of people use generics. In fact, 9 out of 10 prescriptions filled in the US are for generic medications. And generics typically cost much less than the brand name medication. It's also important to note that a generic equivalent contains the same active ingredients as the brand name version, whereas a generic alternative is similar to the brand name medication, but it's not the exact same formulation. So which means it could be a different color, a different shape, or maybe different inert ingredients. Be sure to review your medications regularly with your doctor. There are some brand name drugs that will, come off patent and a generic may come available. So it's always good to review your medication listing regularly with your doctor. Just make sure you're always receiving the best possible, product for your therapy at the lowest possible cost. Prior authorization monitors prescription medications to make sure you're getting a prescription that is suitable for the intended use and covered by your prescription plan. If your pharmacist tells you that a prescription requires a prior authorization, it simply means that we need more information from your doctor to make sure that your plan will cover that medication. Only your physician can provide this information and request a prior authorization. So to get it started, you can contact your doctor's office. A lot of them nowadays can complete it electronically right through their system, and it's turned around very quick. They can also talk to our team via phone, or of course we still do communicate with doctor's offices via fax. Drug quantity management. This verifies the correct quantity, either tablets or capsules of a medication. It ensures that the most cost-effective product strength is dispensed and helps reduce waste. So when you prescribe certain medications that are part of a drug quantity management program, Express Scripts is going to make sure that you receive the amount or the quantity that's considered safe and effective by the U.S. Food and Drug Administration. And a good example of this, for example, might be some sort of pain medications or controlled medications that would fall under this program. So while new members are going to receive an ID card from Express Scripts in the mail, I wanted to point out that you're also able to access your ID card digitally. Your prescription ID card contains important information about your prescription benefit, and it has the customer service telephone number on the back where you can contact that team 24 hours a day, 7 days a week. And you can easily create a digital profile on expressscripts.com or our Express Scripts mobile app to also gain access to your ID card digitally. Or you can also download it to a digital wallet, or also from our website, you can view and print one there as well. Long-term medications are taken over a sustained period of time, so like high blood pressure medications or cholesterol medications. So starting January 1st for the County of San Diego, you're able to receive these long-term medications either through Express Scripts home delivery pharmacy, which you've always been able to do, but starting January 1st, you're also able to fill a 90-day supply of these medications at participating Costco, Rite Aid, and Sharp Reese Steely pharmacies. So you have a greater option of pharmacies to choose from to fill that 90-day supply. Now, while you're not required to move your long-term medications to a 90-day supply at one of these participating pharmacies, you will experience a cost savings and co-payment if you do move these medications to a 90-day supply versus filling it 3 times at a 30-day supply. So please be aware of that and just do some shopping around to make sure that you are, again, filling the most cost-effective medication, but also using the most cost-effective channel to fill your medications. If you choose home delivery from Express Scripts, your medications are delivered straight to your door with free standard shipping. You can transfer those medications easily online by phone or the Express Scripts mobile app. You can also call in to customer service to help you with transferring medications to home delivery. You can enroll in automatic refill, set refill reminders on your mobile app, and also just as a resource and a reminder that you can always get in touch with a Express Scripts pharmacist by calling in comfort of your own home 24/7 as well, using that number again on the back of your ID card to get in touch with somebody. So again, starting January 1st, you can log in, register, and log on to expressscripts.com to get started with moving your medications over to a 90-day supply, or again, talk to customer service, the number on the back of your ID card, to go ahead and they can start that for you as well to help guide you. Accredo is a specialty pharmacy which provides personalized patient care for members with a wide range of chronic and complex health conditions. A specialty medication is a medication typically used to treat chronic complex conditions like multiple sclerosis, cystic fibrosis, or cancer. Your Accredo team is here to make your path as smooth as possible along, and will be with you along the way. So they do that by having specialty clinicians as your guide. Our specialty trained pharmacists and nurses are available 24/7 for any questions about your therapy. You'll receive one-on-one clinical support to help you administer your medications safely and effectively. And your Accredo team helps you manage possible side effects. For certain conditions, Accredo nurses are also there to help you administer your medication in the comfort of your own home if appropriate. The route to getting your medication is also easy. As allowable by law, free shipping is there to where you reside. Medication is handled with care, including any refrigeration that might be needed. And you can also order refills on Accredo's own digital services, accredo.com, and Accredo also has their own mobile app. So there are several resources available to you. A lot of them I touched on here already through the slides. Of course, the number on the back of your ID card gets you in touch with your customer service number. So that is a great place to always just default and dial that phone number, and they can answer questions that you have about your benefit. They can answer questions about moving medications to a 90-day supply. But then that team can also get you in touch with, say, the Accredo team. If you're talking about a specialty medication, they can get you in touch with the Accredo individual at that pharmacy to talk more about that. And they can also get you in touch with, say, a pharmacist as well if you have questions about a drug that you're prescribed. And then the digital pieces of resources available to you, we have expressscripts.com, and then we also have our Express Scripts mobile app. So there, again, you're able to get your digital prescription ID card. You're able to price a medication and research any lower cost medication options. You can locate a pharmacy, so see the nearest in-network pharmacy to your home, and also take a look if there's any Costco, Rite Aid, or Sharp Steely pharmacies that are nearby where you can move to a 90-day supply. And then also on those digital tools, you can also manage your Express Scripts home delivery fills, trigger refills, enroll in automatic refills, look into billing, claims history, and so much more. So there's a lot of resources there for you. I encourage you, starting the 1st, if you are an upcoming member onto the plan, starting the 1st, to go ahead and get registered and get online. And that wraps up my presentation. Thank you for your time today, and I'll be sticking around here for any questions you have as well.
Thank you so much, Amy. Really appreciate all your help. So we're going to move transition into the presentation with a couple of areas of topics that are provided through by not only the carriers but VIBA as well. One question that gets that comes up all the time is, what is our out of area coverage for the plans? And so this primarily is for any early retirees or any students who are currently living outside of the California area. This question comes up. So the way that it stands right now is if you have any employees that are enrolled into the UMR PPO plan or the UnitedHealthcare HMO plans, and maybe they decide to retire and they decide to move out of state. Well, UnitedHealthcare does offer a out-of-area Choice Plus plan, which is a nationwide coverage plan. This is going to be through UMR, where you have the ability to stay on the county's plan. However, you would have nationwide access. So you're going to have different out-of-pocket costs depending on, what the state currently charges for each of their services. There is a deductible tied to this plan, and then your out-of-pocket costs. So this is a nationwide PPO plan that's available. Now, for your your out of area students. So maybe you have students that are currently going away to college, they're going away out of state currently, they have access to this nationwide plan as well. And again, what would happen is the member would stay on the HMO plan that they're currently enrolled into, or the PPO plan if they're enrolled into the PPO plan. And then their dependent student, when they would submit their address to the County of San Diego, which would in turn send that over to VIBA. And then that dependent student would remain on that nationwide plan until they move back permanently or until they age out. And so this is a great opportunity where folks have, any kids that are going away to college, for them to be able to still have nationwide access throughout while they're going away to school. Beginning in 2024, so this is going to be a plan enhancement beginning on January 1st of 2024, is that now the out-of-area plans for dependent students only, so again, as I mentioned, they're put onto a nationwide plan, are now going to have access to SureUs. SureUs is a digital platform where dependent students are going to be able to seek out-of-area providers where their deductibles and their coinsurances are going to be waived. So basically, they're going to stay on that same out-of-area Choice Plus provider network. So meaning that's a nationwide plan. They can look up primary care physicians, they can look up specialists and everything. However, right now, as it currently stands, that whenever they want to seek services, they have to pay for a deductible, they have to pay coinsurance for those plans. Those are all going to be waived. Through SureUs, what they're going to be able to do is they're going to be able to take a look at providers in their area. So for instance, if I have a son or a daughter that's going away to college in Texas and they need to go see someone, maybe they have the flu, or maybe they just need to check on routine care, etc., then they can go through SureUs and they can take a look at a multitude of different providers that are available to them. And they can see all the different providers in the area of which they reside. What's great is they can look at it by the type of service that's going to be offered in that particular area, and they can pick and choose which provider they want to go to. What's even more comprehensive about SureUs is that they will be able to see what the out-of-pocket cost will be for that particular service. So you may have a doctor that may charge you $20 copay for that particular service. Maybe outside the area, they have someone else that's $30. So they'll be able to take a look at what the actual copay for that service will be. And then they can go ahead and set an appointment, lock in that appointment, and then they can even lock in that price for that particular service that they have. So this will begin again on January 1st of 2024. And basically, if you have any of those out-of-area dependents, they'll automatically be enrolled into this once you submit your dependent's address to the county. So really great benefit enhancement for your kids to be able to get out-of-area coverage. Now, whether you enroll into a UnitedHealthcare HMO plan or the PPO plan, there's a lot of additional benefits and resources that are available to you and your dependents at no additional cost. So you automatically become a VIBA member when you enroll into one of these plans. And so we're going to talk a little bit about all the new enhancements and all the additional features that you have being a VIBA member. The first one being, and this is also beginning in 2024, this is probably the biggest news that we have so far that we are really excited to announce, is that beginning in 2024, VIBA has now partnered with Kindbody. What Kindbody does is they're a holistic approach towards fertility solutions. So right now, currently as it stands, you're paying out of pocket for any type of fertility treatment because it's not covered under the UnitedHealthcare HMO plans or the UMR PPO plan. However, in 2024, you will now have access to Kindbody. As you know, fertility solutions, they range. Treatments range anywhere from $1,000 to $20,000. And then fertility procedures can all the way get up to like $70,000. So we understand that fertility benefits, they come at quite a cost, and that is incurred by, the members and their families. And, that's not covered by their benefits. So beginning in 2024, you will have access to Kindbody. And really what Kindbody does is they, as I had mentioned, provide more of a holistic approach towards fertility services. And really what they will do is they have clinics that are located all over California, and I'll show that the different locations that they have on the next slide moving forward, but they will be able to help you with all the stages of your fertility benefit. And so they can work with anybody that's just trying to learn about fertility. You know, they can assess gynecology, urology, preventative care, all the way up to, you know, new patients who are currently going through fertility solutions, if they're trying to build their families, or if you have any expecting parents. And then they'll even work with you through the whole live birth process, and then any post fertility as well. So this is a really great process, or partner, where you will have kind of a concierge sort of hand holding, if you will, all the way from the beginning stages of actually learning about how the program works, all the way to through live birth and what kind of post-fertility options are available to you. And so where they're located, well, there's a lot of different clinics that are all around. Their signature clinics, you can see, are listed here in yellow, with the addition of 2 more clinics that are going to be opening up here in the 2024 Q1 timeframe that they're looking at. I believe they're looking into La Jolla as being one of them. I'm not exactly sure where the other one is located at this point, but basically you can see here all the different signature clinics as well as affiliates where you can access the Kindbody fertility solution that's available to you. Also, included in this is menopause. You know, as we know with fertility solutions, you know, menopause, it can also, you may need to speak to someone with regards to anybody that is going through menopause. So if you need to speak to a nutritionist or a therapist or any type of coaches, they can go ahead and assist you with any type of menopause support as well. There's a lot of different program features that are listed over to the lower right. Lower left. I'm not going to read each and every single one of them, but they really can help you through menopause as well. And so who's eligible? Well, basically anybody who enrolls for the County of San Diego into the UnitedHealthcare HMO plans, the UMR PPO plans, or even the SIMSA, which is the across the border plan, are eligible for the Kindbody benefit. And so they will be able to receive up to 1 Kind full cycle, which basically means, you know, the consultations, to anything from fertilization or IVF to insemination, IUI, basically all the treatment that is needed, all the consultations, and actually going through an entire Kind cycle will be covered at 100% by VIBA. And basically, if you go through that Kind cycle and, you know, you're going through one of their signature clinics, you find out it doesn't work out, however, you want to try it again. If you do want to use the Kind cycle for a second time, then basically you will get it at a discount. I want to say it's up to 20% off whatever the retail costs for those services are. But for the members accessing fertility solutions through Kindbody for the first time, the 1 full Kind cycle will be covered at 100%. The next benefit that we're going to talk to you about is going to be through GoodRx and Express Scripts. So as you know, there's a lot of different drug manufacturer coupons that are out there that can let you know that there's a way to save money on different programs. And this was actually implemented back in April of 2023, but Express Scripts has partnered through GoodRx through what they call their Price Assure. And basically what this does is it allows members to get their generic prescription medications at the lowest cost. So whether the price of a GoodRx generic prescription drug would be, or through your Express Scripts, you know, for that same generic drug, whatever the lowest price will be, it'll automatically be locked in. So basically Price Assure is going to take a look at, you know, whatever the cheapest price for your medication is and make sure that you automatically get this at the lowest cost. And so you don't need to sign up for GoodRx in order to do this. Basically, Express Scripts has already partnered with GoodRx through the Price Assure to guarantee that you are getting the lowest price for those generic prescriptions. Also through Express Scripts, this was this is not a new benefit for 2024. However, this was introduced, I want to say, last year and then even a couple years before, was with regards to certain types of generic medications. Hypertension or diabetes medications and even cholesterol medications have become quite popular amongst our VIBA members. In fact, they actually attribute to almost about 20% of our members are on a regular basis taking hypertension, diabetes, and high cholesterol medications. And so we never really wanted costs to be a burden for those folks that need any type of generic hypertension, oral hypoglycemic, or even preferred generic cholesterol medications, my apologies. So when you are accessing these type of medications, as long as you go through Express Scripts Smart 90 retail pharmacies, as Amy had mentioned in the previous slides, and that's for any long-term medication. So if you are taking any of these generic type of medications, they will be at a $0 copay as long as you access it through the Smart 90 program. And so the Smart 90 program, again, is Costco, Rite Aid, as well as the Sharpery Steely pharmacies, or through the home delivery. So as long as you order that 90-day supply, then you will have these type of medications at a $0 copay. Also through Express Scripts, they have their Save on SP program. There are certain types of medications that can be quite costly. These could be, different types of cancer medications or chronic illness medications. And these medications can range anywhere in the tens of thousands of dollars per prescription up to six-figure digits for just certain types of prescriptions. And so if you do have to take any of these type of medications, then as long as you go through Accredo, which is their specialty medication, then you have the ability to get these medications to either a $0 copay or a very minimal copay. And basically you would go through their Save on SP program. You would sign up for Save on SP for any of these type of medications, and then you can go ahead and get these type of medications where they will be at a much, much lower cost than what their retail value would be. So it's very easy. You can always call the 800 number below, or you can go to saveonsp.com/VIBA to go ahead and get started. As Nick had mentioned before, chiropractic and acupuncture is available through the benefit plans. And basically, this is where we are allowing members to go and see a chiropractor or an acupuncturist for unlimited visits that are subject to medical necessity. As Nick had mentioned, you go simply to MyOptimHealth, physicalhealthofcalifornia.com. And as long as you go to one of the in-network providers that's shown here, you can access a chiropractor or an acupuncturist at the appropriate copay based on whatever your primary care physician copay is. So if your PCP copay is between $0 to $10, then basically your chiropractic or acupuncture copay would be at $10. Same thing with the 15 or 20, and then also the 25 and above. You can see over on the right-hand side, what your chiropractic or acupuncture copay would be. As long as you go to that website, you find an in-network provider. As Nick had mentioned, you want to use the access code California Schools VIBA to take a look at all the different providers. And you can do a provider search, based on, if it's a specific provider that you want to look for, whether it's the doctor's name, or if you want to take a look in geographical location, you can pull up, your zip code. You can take a look at all the providers that are in your area as well. Next, we're going to talk about the VIBA advocacy. So this is a benefit that's available to you. And really what the VIBA advocacy department is they're here to advocate for you. So navigating the healthcare system can oftentimes be quite tricky. If you're calling a provider or a carrier, maybe you're getting bounced around from phone tree to phone tree. Really, our advocacy department is our in-house dedicated team here to assist you with any questions that you just can't seem to get the answer to, either through the carrier, the medical group, or even your doctor's office. These can include anything from access to care, the quality of care you're getting, scheduling timely appointments, transitioning to a new provider, as Nick had mentioned. If you're switching from one plan to another and you need help with locating providers, our advocacy department is great at assisting you with. So they can help you with any kind of denial of care, Maybe you're receiving a bill in the mail and you're not exactly sure why for a particular service where you thought it was covered under your plan, and you need that assistance to see, if you're paying the right out-of-pocket cost for that particular service. Advocacy can help you. They can work on the back end with either the carriers, the medical groups, or the doctor's offices to assist you with making sure that they get the answers to those questions. So I provided their contact number below. They're absolutely fantastic. One example that I've seen firsthand that I use all the time is I've had members actually standing in line at the pharmacy trying to get their prescription. And for whatever reason, the pharmacist is not able to pull up that member's information. So they're going to charge them retail cost for that particular drug. Well, I've actually had the members reach out to our advocacy department, and the advocacy department can even reach out to the pharmacy, provide that member's information, and then make sure that person gets the prescription at the appropriate copay instead of paying that retail cost. So that's just one example of many that I've seen, but they really are here to advocate for you. They are available Monday through Friday from 8 a.m. to 5 p.m. Teladoc Medical Expert Service is a second opinion program. So this is the next benefit that's available to you. And really what Teladoc Medical Experts, there is their virtual care. However, they do offer a second opinion program. If you are someone that maybe needs to have an aggressive surgery, or maybe you've been diagnosed with a chronic condition and you need to undergo a certain type of treatment, then before going under those type of treatment options, maybe you want to get that second opinion. And so Teladoc Medical Experts can assist you with that. And basically, it's really easy. I provided their 800 number as well as their website. And really, you get in touch with them. You let them know what's going on. Hey, maybe I'm having a knee replacement, or a different type of procedure, and I want to get that second opinion. And then what they're going to do is they're going to have that consultation with you. And then with your permission, they're going to ask to obtain access to your medical records. And you can share whatever medical records that you want to be able to share with them. This could include, any consultations that you've had with doctors or specialists. It could be, any MRI scans or x-rays or lab work. And then what they're going to do is they're going to take that information, they're going to send it up to one of their 50,000 world-renowned doctors. And they're going to look for an area or a specialist in the area of expertise of whatever it is that you need. So for instance, maybe you have a knee, maybe you need to get a knee replacement. They will send that information up to one of their world-renowned knee doctors, and then that person is going to get in touch with you. They're going to look and see what they're seeing. They're going to let you know if you're getting the right diagnosis, the right prognosis, the right treatment options for you. Maybe there's an alternative form of treatment that's available to you. Maybe the surgery is outdated that you're about to have, or maybe there's no surgery needed at all. Maybe there's an alternative form of treatment. And so whatever decision that you make, then you will feel confident knowing that you are absolutely confident in whatever that decision is. So that's really what it is it gives you that peace of mind, that second opinion, so that you do feel confident with whatever type of treatment that you want to go ahead and explore. I hope this is a service that none of you ever have to use. However, it is great to know that it is here. Again, this is covered for you and your dependents at no additional cost. Not only do we want to take care of you, but we also want to take care of your four-legged friends as well. So we have partnered with Inside RX Pets, where you have the ability to save on certain types of pet medications. You can see anywhere a savings from 77% for generics and up to 15% on certain brand medications as well. Now, I did go ahead and check, and unfortunately, flea medication is not included in this. However, there are a lot of different types of medications that maybe your pet is taking where you can actually go ahead and get this at a reduced rate. It's very simple. You just simply go to the website that I provided here, and then you can take and register. Once you've gone ahead and registered, you can get and print your ID card, and then you can go ahead and show your ID card at one of the 40,000 pharmacies that they accept Inside RX Pets, and automatically get that prescription at a discounted price. Very easy to get started with that. Just simply go to the website. And then if you ever want to see a list of the formulary, that the different types of medications that are available under the program, they have their formulary posted on there as well. Carum Health. So Carum Health is available for any members that are on the PPO plan. So if you're on the UnitedHealthcare HMO plans, then this does not apply to you. This is only for members that are on the PPO plan. And so really what Carrum Health does is it basically provides, anyone who's planning hospitalization for one of the following procedures. So this could be anything from spine procedures, orthopedic procedures, coronary artery bypass graft, also known as CABG, or even bariatric surgery. And really what Carrum does is they've gone ahead and taken a look at the different hospitals for these different types of procedures, the doctors that perform these type of surgeries, also, the type of equipment that's being used, as well as the outcomes for these type of procedures. And what they've done is they've gone ahead and rank them, and basically they will refer you to one of the hospitals where they are known for the certain type of procedures. So for instance, if I need to have, again, that knee replacement, and I contact Carrum Health and they say, okay, Hoag Hospital in Long Beach is really world renowned for doing a lot of knee surgeries. They have the lowest amount of readmissions. The medical equipment they use to do those knee replacements are state of the art, and then the doctors have the best outcomes possible. Then they may refer you to that hospital for doing that type of procedure. So the way that works is if you call Carrum, you listen to what they have to say, you want to go ahead and use Carrum for that surgery benefit. Basically, your surgery is covered at 100%. So all copays, all deductibles are going to be 100% waived. Any travel expenses that are needed for the benefit are going to be waived as well if you need to have any kind of a lodging or meals or anything like that. So basically, the whole process is going to be covered at 100% if you go through the Carrum process. If you decide that, you contact Carrum, you hear what they have to say, instead you want to use the doctor that you're currently seeing for that type of procedure, that is perfectly fine as well. Then basically what would happen is you would just pay whatever your normal out-of-pocket expenses would be for based on that plan, on your PPO plan offering for that particular procedure. So you don't have to utilize Carrum, but if you do, then your surgery would be covered at 100%. Finally, we're going to touch base on the VIBA Resource Center. As I've done this presentation over the last couple of years, the VIBA Resource Center has become quite popular with our County of San Diego employees, because you guys are literally right in our backyard. So right now, you guys are the employees that are currently off Ruffin Road really only have to go down about one block, and our VIBA Resource Center is available to you. And so for those of you who don't know what the VIBA Resource Center is, basically, I want to say back in 2019, we opened up our first doors of the VIBA Resource Center in Hotel Circle South, so in Mission Valley. And we've since then opened up our second location that is in Kearny Mesa. Now, we are looking at different clinics that are available in the South County region, as well as in the Carlsbad region. So more information to come. But right now, currently what's open to you is off Ruffin Road in Kearny Mesa, as well as the Mission Valley office in Hotel Circle. And really what it is it's a place for folks to be able to overcome whatever well-being challenges that they may have, whether it's physical, mental, social, emotional. There's a multitude of resources at our resource center that are available to you where folks can live their happiest and healthiest lives. And so we provide a holistic approach on different types of classes that we offer, where you can work on whatever those challenges that you may be going through. So really, what can you expect at the VIBA Resource Center locations? Well, at the physical locations, we have different types of classes that are available. These can be anywhere from movement classes to stress management classes. There's personal and professional development. And then our most famous are our cooking and nutrition classes that we have available to you. So a lot of these classes could be anything from yoga, meditation. We have sound healing classes. There's stress management classes where you have the ability to try acupuncture or acupressure, different types of meditation sessions that are available to you. And then we even have financial workshops that are available to you as well. And then, as I mentioned, our cooking and nutrition classes are absolutely phenomenal. They're performed by our very own chef, Leslie. Somehow, I don't know how she does it, but she can somehow take broccoli and turn it into bacon. it, or make it taste like bacon, I should say. So she's absolutely fantastic. So if you want to take a look at any of the classes, they are free to you. You just simply go to our website at vibaresourcecenter.com/classes to take a look, and you can sign up for as many of these classes that are available to you. Now, as I mentioned, that you can come to the VIBA Resource Center, take part in any of the classes. You can stop by. We have a full service gym in there that you can go ahead and work on yourself as well. There's open gym nights where you can exercise at your own pace. However, we do have a lot of different uh, offerings that are available to you. These include massage chairs, as I mentioned. If you wanted to try acupuncture or acupressure, you can go ahead and do so as well. But since the pandemic, we realized that, sometimes it's a little bit hard for folks to be able to get to the resource center location. And so we have a lot of virtual content as well. And we have over 200 different monthly classes each and every month that you can take part in. So the yoga classes, the meditation classes, the financial workshops, you can take part in as many of these virtual classes that we have available to you as well. So you can you can go to vibaresourcecenter.com and you can really take part of these classes right from the comfort of your own home. If you ever want to visit the resource center, then we encourage you to come on over and take a look at it. If you have a meeting that you would like to host with your colleagues and you want to take a look at the different offerings that are available to you, or maybe you want to try the VIBA Resource Center in a group setting, feel free to reach out to us and we will be more than happy to assist you with showing what the facility is all about, all the different resources that are available. You can even try some of the different equipment that's available to you as well. And we can even provide you lunch. So we're happy to bring or have you at our locations. And then finally, we can also bring the resources out to your site as well. I know that the County of San Diego has a very robust well-being department, and so we are happy to partner with the County of San Diego and provide additional resources about bringing wellness to your site locations. Also, you have access to our care navigators through the VIBA Resource Center. Basically, this is more of a one-on-one type of consultation. So maybe you want to speak to someone individually about whatever well-being challenges that you have. Then you can always speak to one of our care navigators at no cost, and they will have that kind of consultation. Our care navigators are basically nurse practitioners that can assist you on more of a holistic approach on whatever challenges that you may have. And what they're going to do is they're going to work with you on whatever goals that you want to achieve and develop and strategize a plan that works best for you. As you know, healthcare is not one size fits all. What works for one person is not necessarily going to work for the next in person. So we want to make sure that we custom tailor a program that we know that you feel confident that you can succeed in so that you can achieve your well-being goals. And so our care navigators are here to work with you one-on-one. And then, as I mentioned, we do have well-being consulting as well. So if you would like to bring any of the well-being classes out to your site locations, then we are happy to do so. As I had mentioned before, we do partner with the County of San Diego through their well-being department on a continual basis. And we're really happy with this partnership where we can bring a lot of different activities out to your site locations as well. But if you are interested in gathering more information, I have provided their website, and one of our team members will be in communication with you. Through the VIBA Resource Center, we've had many different testimonials where we've actually had great responses on different types of outcomes, whether they're in-person well-being services or if they're meetings that are hosted at our VIBA Resource Center location. So I'm not going to read the actual testimonials, but I just want to let you know that, folks that actually do access the VIBA Resource Center, whether it's in person, whether it's virtual, or whether it's through through the county at one of your site locations, we do get really positive feedback. So please feel free to access this. Again, the VIBA Resource Center is for you at no cost. With that being said, I know we went through a lot of information. There's so much content that we went through. I just want to provide you again with some of our contact information that we have available to you. So this includes our advocacy department with any questions that you may have navigating the healthcare system. And then we have a lot of additional content as well at vibaonline.com. With that being said, again, my name is Matt Ogden. I am your dedicated account manager for the county, so please feel free to reach out to me with any questions that you may have. I've also provided Heather Simonson, who is our VIBA ombudsman. She's here to assist with any questions or help you with anything that you need as well. So I've provided her information as well. And with that being said, that does wrap up our presentation. So at this time, thank you so much for participating. I'd like to thank our carrier partners for going through all the different plan offerings, all the benefits. We really greatly appreciate it. And then finally, just want to thank the county for allowing us to be here to be able to present and provide you guys with all the resources that are available to you during this open enrollment period. So thank you guys so much. We are happy to stay on and answer any questions that you may have. We really appreciate you being here today.
Oh, great. Thank you very much, Matt from VIBA, UHC and Express Scripts representatives. We appreciate all the helpful information for our employees to make fine decisions about their medical coverage in the coming months. We did have a few questions come through. And for those of you who joined late, I don't know if you were aware of a QR code to submit your questions. So quite a few of you may have missed that opportunity. So what I did do is open up the chat box. So myself, Nick, Rochelle, and Amy, we have been answering questions as they have come through the chat. So thank you very much, everyone, for your questions. Hopefully we addressed all of them. But for those that did put their questions through the QR code, I would like to present those to you, Matt, and anyone else on the team. So our first question that did come through, does chiro and acupuncture need to be referred by a primary care physician?
That is a great question. The answer to that question is no, you do not. As long as you use one of the in-network providers through the Optum, My Optum Health Physical Health of California, then you do not need a referral. You do get unlimited visits based on medical necessity. What that means is basically you can't go in like every single day and try and see an acupuncturist. What they're going to do is they're going to find out whatever challenges that you may be having, whether it's through acupuncture or through chiropractor, they're going to set you up with a certain number of visits that are available to you. And after so many visits, if they notice that you're not getting any better, then they may actually ask you to refer back to your primary care physician or your specialist to get additional treatment options that are available to you. But as long as you go through an in-network provider, then no, you do not need to have a referral to access those services. Great question.
Well, it looks like a follow-up question to that is the acupuncture active this year too, or is it only in 2024 and onward, it sounds like?
Acupuncture is going to be available. That's a great question as well. 2024. So beginning on January 1st of 2024, you will have access to the same acupuncturists, or you will have access to Optum's in-network providers for acupuncture as you do through their chiropractors.
Great, thank you, Matt. Another question. Is there a way to find a doctor that has a holistic approach to medicine under the networks?
Great question. I'll let the carriers answer those type of questions pertaining to the HMO plans and the PPO plan. However, VIBA does provide nothing but holistic solutions for any type of well-being challenges that you may have. Again, as I mentioned, whether it's physical, mental, emotional, social, the VIBA Resource Center has a lot of different resources that are available to you. All done through a holistic approach. So there's no prescriptions that are being prescribed or anything like that. It could be through sound healing. It could be through meditation. There's all different types of stretching and movement exercises, whether it's healthy cooking and nutrition, or even different types of workshops that we have available. So I definitely encourage you to reach out and take a look at the VIBA Resource Center website, so vibaresourcecenter.com, to see all the different type of classes that are available. But with that being said, Nick and Rochelle, I mean, can you guys discuss, the different options that are available, either through UnitedHealthcare or UMR as far as holistic type treatment?
Yeah, Matt. If I'm being honest, I'm not positive. I'm trying to scramble and look right now. I know typically the providers on the site are um broken up by their specialties, whether they're, if they have a specialty, if they're a general practice, family practice, internal medicine, things along those lines. Um, I'm trying to look and see if there's a filter for holistic. But I don't believe so. Typically, in those types of situations, what a lot of people will do is they may Google holistic providers in their area and then verify if they're a network on our website. Um, Rochelle, do you know? I mean, I know we
I
utilize the same site.
Yeah, actually, I just did that last week for a member. They were asking about a holistic provider, but I couldn't like search specifically for that in our network. So what I did is just kind of looked up where they were and looked up on Google, and then it gave a couple of lists of providers that's in their area, and I just basically looked up the provider's name in our portal, and that's one way to do it. And again, if they're having issues, you can also call our customer service, and they would pretty much do something similar, but there isn't an option in the find a provider that would say like a holistic provider listing kind of a thing. It's just more of like Nick said, we did a search on Google, and then when we found a provider name or a name of a facility, we looked them up into the network and saw if they were in network.
Fantastic. I mean, could potentially the primary care physician or the specialist or whoever they're actively seeking possibly refer out if there are any providers that are in network?
Yeah, absolutely. I mean, if they have an assigned physician that they're working with and they ask them that question and they're familiar with any doctors that have an holistic approach, absolutely they can refer them.
Yeah,
That's also another option. It's a great add-on there, Matt.
fantastic. And so just also want to reiterate that, when you do enroll into a medical plan, whether it's through UHC or through UMR, then you automatically are a VIBA member. You have access to the VIBA Resource Center, which is nothing but holistic type solutions for VIBA members. And so they're at no cost to you.
Great. Thank you. Another question we have is regarding massage. Are massage services covered if deemed medically necessary?
Another great question that we get, unfortunately, massage therapy is not covered under the medical plans. We do at the VIBA Resource Center have massage chairs that you are able to access and utilize. Maybe you're going through one of the classes and you want some downtime to use the massage chairs. However, massage therapy itself is not a covered benefit under the plans.
Got it. Another great question here. If I want to see a specialist out of network, what would be the procedure to proceed?
I'm going to let the carriers discuss that one. So Rochelle, I mean, if you're enrolled into the PPO plan, from my understanding, you can go see whichever specialist you want. You do not need a referral, correct?
That is correct. And again, you do have out of network benefit coverage. So if you are to see a specialist that's out of network, you have, I believe, it was 60% after the deductible that you would basically be paying for. So you're still covered even if you want to see a specialist that's not in network.
And then Nick, how does out of network coverage work on the HMO plan offerings?
Yep. So on an HMO plan, there are no out-of-network coverage where you can go specifically out of network to see a doctor. However, in the event that you can have a referral approved through your medical group and your primary care physician to see a doctor that's, say, I'll give you an example. If there is you're with Sharp, assigned to a Sharp primary care physician, and you would like to see a UCSD or a Scripps specialist, if Sharp if your primary care physician submits a referral and it's approved to see that doctor, then it will be covered. But that is the only way that you will be able to see an out-of-network doctor in that case. Otherwise, they will not be covered and you cannot self-refer to a specialist out of your particular network.
Wonderful. Thank you.
Wonderful. This one here, another question, is UnitedHealthcare separate from SIMSA?
Yes. So UnitedHealthcare are HMO plan offerings that are accessed inside California. SIMSA is another carrier that where you have the ability to access care across the border. So I believe on September 21st, if you are enrolled into the SIMSA plan, we are going to be doing an open enrollment meeting specifically for those who are enrolled into SIMSA or would like to enroll into SIMSA, where we will actually have SIMSA only speak along with VIBA on how the SIMSA plan works.
Excellent, excellent. Another question, is Teladoc the only other way to get a second opinion on a medical condition that is covered by UHC HMO VIBA?
That's a great question. So I can tell you, as being a VIBA member, the Teladoc Medical Experts is really the partnership that we utilize for that second opinion program. However, Nick and Rochelle, I mean, are there other providers where members can go ahead and get second opinions for whatever procedure they may be considering?
Yeah, absolutely. Let's say that you were referred to a specialist for a procedure and you would like a second opinion. What we typically recommend is speak with your primary care physician about a referral to an alternate doctor. Um, you know, they can always refer you for a second opinion on that particular condition. What we've also seen are sometimes people have specific doctors in mind. And again, where, you know, sometimes it's an out-of-network doctor because they specialize in a specific situation. Again, you always want to speak with your primary care physician to submit that referral for that doctor. And that is a process to get those second opinions covered outside of, you know, the one that Viva currently partners with Teladoc.
And from the PPO side of it, again, you do not need to have a referral. So if, let's say, you had somebody refer and say, hey, I have this great doctor and you want to check it out or kind of thing, I mean, you do have that option of doing that. And again, if that provider happens to be out of network, you do have out of network coverage as well. So you'll be able to get a second opinion without getting a referral. And if the referral, or even if the provider that you sought to get a second opinion from is out of network, you are also covered.
Excellent. Can any of you answer this question about hearing aids? Are they included on any of the plans? Be it PPO or the HMO?
Yes, there are hearing aid coverage on the HMO plans.
And same with the PPO plan.
And are all members part of the Optum coverage or a la carte segment of the plans automatically, or do they need to sign up?
Another great question. So as long as you're enrolled into the UnitedHealthcare HMO plans for your chiropractic and acupuncturist, as well as through the UMR PPO plan, then basically you have access to Optum. So basically you would just go to that website that we provided, My Optum Health Physical Health of California, for chiro and acu services. And then again, as long as you go through the chiro and acupuncturists, then basically you have those unlimited visits. So you'll just want to go to that website to look for chiro and acu services. For any of their additional services, I do not believe that those would be covered. So Nick, Rochelle, I mean, do you know if there's any other services that Optum provides, with the exception of the virtual visits for the UnitedHealthcare PPO plans? If you want to use Optum for the virtual visits, then that's covered at no cost as well.
I believe, yeah, I'm looking at the plan right now, and it does say that, I mean, they can see them. It's 100% covered by the plan, and the deductibles. Oh, I'm sorry, that's not the right one. No, yeah, it does. It's just, we're just requiring that it's reviewed after 30 visits to see for medical necessity if it's based on a chiropractic designation and procedure code.
Okay.
We have a follow-up question regarding the hearing aids. Are repairs included with the hearing aids, repair fees or anything like that?
Yeah, so I actually saw the question. I pulled up the summary of benefits, and repairs and replacements are not recovered unless it's the exception is malfunctions. If there's a malfunction on a hearing aid that you received on the benefits, then that would be the exception where it can be covered. Otherwise, they are not.
Correct, and it's the same for the PPO plan.
Great. Okay. So we have another question. Does the new kind body benefit include egg retrieval or storage? For example, medications, hormones, or anything needed prior to retrieval?
I believe it is all covered under the kind cycle that's available. We're going to be providing, so there's a lot more information to come with Kind Body that we're going to be providing so that our members will be able to reach out to one of their advocates that can really go through the process with you. So I don't want to say necessarily yes. I believe it is. However, I would wait until we're able to provide you with a little bit more information, because would probably want to refer you to one of the Kind Body representatives to really discuss, all the features that it has available to you. But I know there's so many different treatments, procedures, things like that that surround the entire fertilization process that would be included in that one Kind Body cycle.
Excellent. Sounds good, Matt. Thank you. Looks like we've just about answered all the questions in the chat. If anybody has any others, feel free to type it in. As a reminder, for all, this session is being recorded, and it will be posted on the open enrollment website. Earlier, I posted a link to the county's front-facing open enrollment webpage. For those of you who've already taken a look at it, some of the information still includes current plan year for 2023, so that is still in under construction as we speak. And the live open enrollment page for all county employees will go live on September 12th. So I just want to share that information. So what you see on the front facing is still under construction, and you'll still see a little bit of current information versus 2024 information on that webpage. Okay, another question here. Is the chiropractic benefit currently in effect for 2023 or similar to acupuncture? Wait, let me ask this question again. Is the
Yeah.
They're
No,
asking
I
about
see
the
it. I see it.
chiropractic
Great
benefit.
question.
Perfect.
The chiropractic benefit is available as of today.
Sorry, that was a tongue twister for me for some reason.
Totally, completely understand. Yep. Great question. So, yes, and that is again through Optum. So you would go to that My Optum Health Physical Health of California, use that access code California Schools VIVA, and you can do a provider search and seek the chiropractic services. Well, thank you for putting that website in the chat, Nick.
Yeah, I figured it was a long one. It might help.
If we have no more questions, this could conclude our virtual fair with UnitedHealthcare. Thank you, everyone, for attending and making time in your busy days. And thank you to our presenters for making time in their busy days as well. We truly appreciate all this detailed information. I hope everyone has a good day.
Appreciate it. We'd like to again thank the county for allowing us to be here. Thank you so much.